but rather to the federal, rather to our sort of federal partners, right? I think that is really kind of an important thing. The exact language, and I'm just scrolling down to make sure I get it right. Let's see. The Pima County Board of Supervisors requests the governor reconsider the matter. If the governor does not approve a federal vaccination center in Pima County, the Board of Supervisors requests the Biden administration, in keeping with their national strategy goals for COVID-19 vaccination, direct the Department of Homeland Security Secretary and acting Federal Emergency Management Agency Administrator to establish a federal vaccination center to provide vaccine opportunities to disadvantaged and minority communities. That's exactly the language that is in there. So yes, it ratchets up that appeal. It pushes it up to the feds, and it puts it at their feet. So we will see what comes of that. We really think that this is the right strategy in terms of, if we really are serious, if our community is serious about making sure that the greatest number of people are vaccinated in this community as possible, that we distribute that vaccine equitably, this is the right strategy. Given the constraints in terms of the federal vaccine supply, how can anybody say no to an additional 220,000 doses of vaccine is difficult for me to understand. Next question.
All right. Next up is Bud Foster, followed by Christopher Conover.
I think that was just...
Dr. Garcia, thank you very much for doing this. We really do appreciate it. We asked the governor if he would reconsider. The governor said yes, he will reconsider. We don't have any other details than that. I think Patty seemed to have more than we did. But if in fact he does reconsider and we do get the pods and we do get the doses, Chuck this morning was talking about how this is not just health related, but economic related as well. Could you expand on that a little bit about what these 210,000 doses would do, not only for the health field here in Pima County, but our economy as well?
But it's so critical that our economy, our community is so challenged by the pandemic. It has really been a very difficult and has had a very difficult and devastating impact on so many families, on so many businesses, and on so much activity that is essential here in Pima County. The sooner that we are able to achieve a high degree of vaccination, the sooner we are able to achieve a level of community immunity. I call it community immunity, 75% vaccine coverage or more, the sooner we can get back to near normal. And I really believe that this is within our grasp easily before the end of the summer, if we have these additional doses of vaccine in hand. The county administrator embarked on a very ambitious goal of delivering over 100,000 vaccines per month for the first 3 months of the year. We have met and exceeded that goal. We are well over, by this weekend, we will be well over the 450,000 vaccines administered. And so we are so close to being able to get back to a more normal state of affairs that I am very hopeful that the governor will, and very thankful that the governor would reconsider his initial action, because I do think that it is the right thing to do, not just for the people of Pima County, but for the people of the state of Arizona. Next question.
Okay, next up is Christopher Conover, followed by Valerie Cavazos.
Good afternoon, Dr. Garcia. I wanted to touch on something else you said, the change in eligibility. 55 plus will still be, no matter what, if you're over 55, you can get it. But 16 plus, there are some caveats. You talked about one of the reasons change was to avoid confusion because now the state UA site is 16 plus. Concerned that there still will be confusion because anybody 16 plus can go to UA, but for the county ones, you have to have certain jobs or certain medical issues?
Absolutely, Christopher. Absolutely. Anytime that we are even a hair difference, it creates challenges and confusion for our community. But the situation that we're in, Chris, is that we have a limited vaccine supply, and we have made, as a county, a policy decision that we need to get that to the most vulnerable people. And we have defined vulnerability on the basis of age, right? That's why 55, that's why we concentrated so fiercely on 75 plus initially. Then we moved it up to, 65, then 55. That it has been a very sort of methodical kind of decision to move up the risk ladder. Now we've identified individuals who are doing essential work across a variety of industries and making sure that they are protected. Now we're also identifying people who have chronic medical conditions. That individual who may be overweight, may have asthma, may have a variety of issues that really compromise her or his health. It's really more critical that they get vaccinated than the healthy 18-year-old U of A student, quite honestly. So from our standpoint, we still want to focus on the communities, on the portions, the segments of this county that have the greatest risk. And we know that those risks are not evenly distributed. And we know that people who live in congregate settings, whether it be shelters, whether it be residential facilities, we know that they are at greater risk. We know that people who have chronic diseases are at greater risk. We know that people with disabilities are at greater risk. Therefore, where we have some latitude, we will continue to offer preferential access to that population. Next question.
All right. Next up is Valerie Cavazos, followed by Paul Ingram.
Hi, Dr. Garcia. We talk again so soon, but if the governor then reconsiders and the board has been directed to make this appeal to the feds, what happens then? Do you need the feds after that, or are you just going to, rely on the state helping and guiding? What do you plan to do?
So, it depends on what the reconsideration is, right, Valerie? So I'm hopeful, and I was not aware of that until Bud brought it up. I'm hopeful that what this means is that the governor will call up the administrator at FEMA and say, yes, please. And then we are happy to engage both with the state and with FEMA to make it happen. We believe that most of the heavy lifting will be on our side of the issue, on our side of the table, in terms of providing space, providing the access to spaces, et cetera. I believe it will be mostly on our side it will be mostly our responsibility to provide. But certainly we appreciate and we want and we hope for a very close-knit coordination with our colleagues at the state, because at the end of the day, again, the reason the governor would do this would be for the benefit that it brings to the entire state. So of course we would coordinate with ADHS. Of course we would coordinate with whomever the governor would designate on this issue. But we would continue to advocate for the selection of sites here in Pima County that specifically allow us to reach Latino and African American populations as well as low-income populations, because we believe there continues to be a need for those populations to be prioritized. Next question.
All right. Next up is Paul Ingram, followed by Stephanie Innes.
Hi, Dr. Garcia. This is Paul Ingram, this is Sentinel. Thanks again for having these calls. During the meeting today, the county administrator noted that we now have one of the new variants of COVID-19 in the county. Can you talk about how that was found, and you can talk about what that effect is going to have, in at least from your point of view, on vaccination efforts and also potential cases?
Thanks for the question, Paul. If you remember, about 3 weeks ago, so 3 board meetings ago, not last Tuesdays, but the 2 Tuesdays before that, we first talked about the fact that surveillance activity, you know that we send a certain percentage of our positive tests here from Pima County. We send it up to TGen that does further analysis to identify potential variants. Back then, we identified the fact that we are starting to see the first few variants within tests that were collected in Pima County. At that time, we also said that the fact that we're seeing this sort of handful, and I think it was 2 or 3 or 4, really didn't mean that there were just 2, 3, 4 cases, but really that variant and that was circulating in the county. We know that because it's been circulating in the state and it's been circulating in this country. So it was just a matter of time for it to get to Tucson and to Pima County. The other thing that we shared with you, not last Tuesday, but the Tuesday before, in one of the board memos, was that part of the wastewater surveillance that we do collaboratively with the University of Arizona was also starting to pick up signal that indicated the presence of this variant. Again, yet another indication that this variant, which is being seen in other parts of the state, which is being seen certainly across the country, is being seen here in this population. Why does it matter? The reason that it matters is that there's reason to believe, there's some evidence to say that this variant may be more transmissible. It may be easier to catch this variant than the previous type. And so transmissibility is what has driven the pandemic, right? That's why we saw that nasty spike around January, was because all of a sudden we had a critical number of people who were putting themselves in positions where they were transmitting an awful lot of virus. So if you add to that a virus that is potentially more transmissible, it just sort of amps that up. So on top of that, we now believe, based on some data coming out of the UK, that this variant may actually cause more complications, be more likely to cause hospitalizations and potentially even deaths. And so you would start to see an impact if this variant takes hold in this community, and it's not the dominant variant at this point, but if it should, then you would start to see an impact on hospital bed availability, something that we're just now starting to feel like we can catch our breath. So from my standpoint, we're kind of in an arms race, right? We need to vaccinate as many people as possible in as short a period of time so that when that variant sort of circulates in this community, it bumps into an immunized person, because we know that people who are immunized will actually have some degree of protection. It may not be exactly the same as for the non-variant form of COVID, but we do know that they actually have good protection. And therefore, from my standpoint, we're really kind of in an arms race. We really need to get this vaccine into as many people as possible so that this variant does not take hold. Oh, and by the way, it's just one of a whole family of variants that are out there that will eventually come to a lot of different communities. And the importance isn't that the variant is in existence. The importance is that our community is sufficiently protected so that we don't end up having people in hospital, so that we don't end up having people dying, and so that we don't have to see the kinds of very restrictive actions needing to be taken in order to prevent disease. Next question.
All right, we're a little bit past halfway through our time. Next up is Stephanie Innes, followed by Patty Matchler with the follow-up question.
Hi, Dr. Garcia. Just a quick question about, wanted to confirm Tammy Littrell was physically in Pima County last week talking about standing up 1, possibly 2 federal sites?
I will get you that confirmation. In terms of who was physically here, I was actually not there for that meeting. Mr. Huckleberry and Dr. Cullen were the ones that staffed that meeting, but I will get you that confirmation. I believe so, but I will get you that confirmation.
Thanks so much.
All right. Next up is Patty Mackler, and then Eric Fink.
Thanks for the opportunity to ask you another question, Dr. Garcia. So please correct me if I'm wrong in the first part of this question, but just to clarify, Pima County would not have moved to the new vaccine eligibility criteria that was announced today, but did so because of the state changing its criteria. If that's correct, I think you said that earlier. Can you please share how these continuous changes by the state, I know a couple of weeks ago they moved to an age-based criteria, and now they've switched to opening it up to everyone. How does this impact Pima County's efforts to reach its most vulnerable residents and hard to reach residents?
Patty, I like the way you characterized it. So it's not that we would have never opened up to 16 plus. It's that we would have done it on a slightly different schedule. Quite honestly, I wanted us to have covered a heck of a lot more of the 55 plus population before we moved into these. But to be completely honest, we have been talking about how do we make vaccine available to people who have chronic conditions? How do we make vaccine available to individuals who have disability? When do they get to have a bite at the apple? And so it does sort of complicate the way that we do it. We get it. We're a subdivision of the state. We have to take, to a certain extent, the direction and the guidance of the folks at ADHS. But it does cause some challenges here locally, right? We have been very, very active, since the beginning in terms of trying to figure out what are the best ways of delivering vaccine to individuals who have the greatest risk, whether it be because of their age, whether it be because of where they live, because of the kinds of jobs that they do. And it does throw a monkey wrench into it. Having said that, we are the county and we will roll with the punches, and we will do our very best to make sure that the citizens of this county just get the best services that we can possibly provide for them. Next question.
All right. Next up is Eric Fink, and then we're actually going to go to Nicole Valdez after that for a first question.
Dr. Garcia, thank you again for taking my question. If the governor reconsiders, we're told now that he is going to invites FEMA, as the unanimous vote was today. If they do that, do you worry about any repercussions from the state, any legal or otherwise? And do you believe that this is, on the part of the governor, at least for now, a purely political decision on his part?
Well, Eric, I wouldn't impute any motive to the governor. I certainly don't have any more insight than you have into what his thinking is or what the thinking is. I think the bottom line of your question is sort of considers and says no. So what happens if the governor reconsiders and says no is we make this direct appeal to the federal entities, in this case, the Department of Homeland Security and FEMA, and then we see what kind of response we get from them. It would be relatively precedent setting for FEMA to take such an action, and so I know they probably would not do this lightly, and so part of this is we're all exercising levers that we might not have exercised in the past, and it's a little bit of an unknown. At the end of the day, I will advocate for the people of Pima County every single day of the week. I will, and I believe that this is something that is critical and beneficial for Pima County, and it is critical and beneficial for the entire state. We wouldn't be making this appeal if we did not really believe that. So, I guess that's the bottom line for us. Next question.
Thank you, sir.
All right. Up next is Nicole Valdez, followed by Ariana Garcilaso.
Dr. Garcia, thank you for taking the time to speak with us. I think I kind of two-part question. The first is you mentioned that these vaccination sites and these extra vaccines are critical and beneficial to Pima County. I'd love if you could kind of describe the current situation in Pima County and how much this would help you guys in terms of getting more vaccines and getting that federal pod set up, for lack of better words. And secondly, maybe this is more of a personal question, but I'd like to get just your personal thoughts on the county and the state. I know you guys would likely have preferred that the state helped you guys get FEMA in the door and get them set up in Pima County, and unfortunately that has not been what happened. Has this been a frustrating situation for you, upsetting at all for you, and at this point, how are you feeling in the fact that it had to go to this length?
Nicole, I'll take the second part first, right? And you broke up a tiny little bit, but I think so. So we tried very hard. We tried very, very hard to be aligned with the state on public health issues. We bend over backwards where we can to be aligned with the state on public health issues. We do so for a lot of reasons. One of the big reasons being that they have the resources and the mandate to really protect the health of all Arizonans, and that we certainly acknowledge that we are a political subdivision, and that part of our authority derives from the state. But it does put us in sometimes into these kinds of conflicts. I'll tell you, it's not unique to Pima County. I think you can talk to any of the smaller counties, and they also all have some anxiety about the equitability of vaccine distribution. If this was any other emergency, we probably wouldn't care about it. But we are in a situation where it's like the Hunger Games. We have to take relatively aggressive actions to bring vaccine into our communities because of the vaccine shortage. That's not a problem that the state created. That is a problem of vaccine supply, but that is part of the reality, the milieu that we're working in. So I think that is one of the components. I think to get at the second component of your question, or rather, what is the first component of your question in terms of what does it really mean? Francisco, what do these 200,000 additional vaccines, what would it really mean? Well, I'll give you an example. So currently, if you look at the state dashboard, it shows that in Pima County, there have been 417,000 vaccines administered. And a good, 15.8%, 42,182 of the folks who have benefited from that have been Hispanic. You look at the state pods, and you look at the fact that the state pods, which have administered over 787,000 vaccines, that the percent of Hispanic Latino population that they've served is 4.7%, or 24,000 people. So in Pima County alone, with a fraction of almost half of the vaccine allocation that has been dedicated to the state pods, we have been able to achieve a degree of penetration in a vulnerable community that is far beyond what the state has been able to do. It's no fault. I'm not saying that the state is doing anything wrong. I'm saying that Pima County is doing something right. And that rather than being penalized for doing things right, we need to have the resources to continue to move our agenda, which is how do we get the largest number of people covered with the most vaccine? How do we get the vulnerable folks who may not be able to access vaccine easily through other sources? How do we get them into the door before it is too late? Because these communities, low-income communities, communities and people of color have suffered disproportionately, in part because they're the folks who are not able to telecommute. They're the folks who are doing some of the essential work that is essential, but may not be the glamorous, life-saving kinds of things that we associate with that moniker. So from my standpoint, that's what the impact of these 200,000 vaccines, 220,000 additional vaccines could mean to Pima County. It could mean us being able to really put what is already a very aggressive and excellent vaccination effort on steroids and move it forward so that we can enjoy a relatively normal fall. Next question.
All right, next up is Ariana Garcilaso and then Valerie Cavazos.
Buenas tardes, doctor García.
Buenas tardes.
Le tengo una pregunta en español. Si el gobernador reconsidera la ayuda de FEMA, ¿cómo pueden ayudar estas vacunas adicionales a la comunidad de Tucson?
Mira, Ariana, es sumamente importante que tengamos los recursos del gobierno federal para amplificar ya la labor que estamos llevando a cabo aquí en el condado de Pima. Hay un sinnúmero de personas que ya hemos vacunado, más de 400,000 personas ya han sido vacunadas dentro del condado de Pima. Esto traería 220,000 dosis adicionales las pondrían en juego aquí en el condado de Pima. Eso quiere decir que más personas serían cubiertas por esa vacunación. Y en donde estamos ahora, que es en una situación donde hay escasez de vacuna, esas 220,000 dosis son sumamente importantes para aumentar la seguridad del condado. So what Ariana was asking about was essentially what Nicole just asked about, which is what is the role and impact of the federal, of the additional federal vaccine supply. My reaction was the same as what I told Nicole, which is 220,000 additional doses would allow us to make a good and an excellent vaccination program even better. Next question.
All right, next up is Valerie Cavazos and then Paul Ingram. We have about 15 minutes left in our time.
All right, hi. I just got information from our reporter who spoke with Ducey one-on-one. Our reporter is saying that when he asked Ducey specifically to clarify about whether or not he's going to reconsider, Ducey said, "We have reconsidered. We're going to stay the course on where we are." So it doesn't seem like, basically he's saying that it's going to be status quo.
If that's indeed the case, that would be unfortunate.
So what happens now? You just follow the plan as you had with the federal government and...
Valerie, the direction from the board is clear and unambiguous. A 5-0 decision for the and so we would sort of escalate this to the feds.
The clock is ticking. So do you still think that you can meet that March 31st deadline or just that goal?
Like I said, this is the first I'm hearing about it, so we'll have to get back to you with more details, Valerie.
Yeah, as a matter of we're getting two different reports from two different stations. So I know that my reporter said it was one-on-one, so I do trust that. But if we can just get some kind of verification from you guys as well, that would be fantastic.
Next question.
Sorry, yes. Next up is Paul Ingram, and then we'll go back to Nicole Valdez.
So to switch gears a little bit, can we talk about the transportation of migrants from remote areas? During the meeting today, Chuck Huckleberry said that there were some cases of COVID-19. Can you talk about how many cases the county has identified from those groups and some of what effort to do to help quarantine and help doing tests?
So, Paul, one of the things that we did fairly early on is we've been working with the non-governmental organization sector that sort of helps support the asylum seekers as they're making their way through this country. We've worked with them to sort of come up with strategies to reduce the risk of transmission for this and for a variety of different conditions. You'll recall, when it's not Zika, when it's not COVID, it's Zika, or it's something else. So we've been dealing with this for some time. This is also not our first rodeo in terms of waves of asylum seekers. My first introduction to that was with the unaccompanied minors, and it is always difficult and it's always a challenge. And so based on those experiences, we started having conversations relatively early on about how do we create COVID-safe environments for folks to stay in. What do we do in those instances where people have COVID? And how do we support the folks who are providing services to them? And so one of the strategies has been to provide agencies like Casa Alitas and Catholic Community Services with COVID testing, with Binex. Those are the not self-administered, the point of care COVID tests that are commercially available and used throughout government. In fact, they're used in schools, they're used in universities, they're used in a variety of different settings. And so those folks who are coming in to that facility all are being screened. I will let you talk to Teresa Cavendish and Diego Pina, who are the leads over there, who will tell you in excruciating detail what their protocol is. But bottom line is everybody who walks into that facility gets screened, and folks who are positive get sort of segregated and dealt with differently, and folks who are negative their transportation is facilitated to get them to their final destination. That process is working. There has been a relatively low percentage of positives that we've seen in that testing. I was on a call with a variety of federal and agencies and non-governmental organizations across the length of the U.S.-Mexico border, from Texas all the way to San Diego. And one of the things that has been observed is that people are surprised at how relatively low the positivity rate has been so far. Has been the experience here locally. It's been a handful of folks who have come up positive. Again, those people are housed separately in a different sort of circumstances and are provided support separately so that they can recover, so that then they can proceed to their final destination.
Do we have what the numbers are?
So I can tell you that, like I said, it's been a handful over several hundreds. You'll have to ask our friends at Catholic Community Services, because they're the ones actually performing the testing. And even though it is reported up to the state, I don't have those numbers off the top of my head. But out of hundreds of tests performed, there have been. But I will let them give you those details since it's theirs.
Thank you.
Next question.
All right. We have a little less than 10 minutes to go. We'll have Nicole Valdez still being raised. Excuse me.
just wanted to follow up, since I understand you weren't able to hear some of my question. I apologize if my connection isn't great. But also following up to Valerie's point that it sounds like the governor has clarified that he may not be changing his mind on this issue. I asked earlier, and I'd just like to hear what your personal thoughts are. If I know you mentioned that this isn't you, I mean, what are your personal feelings on seeing that this has come to this kind of just getting help and getting more vaccines to the ones who need it in Pima County?
Well, again, and as I mentioned to Valerie, I'll say to you, to Nicole, we don't know what the governor's decision. I better check my email. I don't believe I know what the governor's decision has been, and whether his reconsideration, whether he's reconsidered and the answer is no. It's like when my kids ask for something and I say no, and then they ask again and I say no again. That may indeed be the case. I don't want to prejudge that. I want to wait for an official communication to come through appropriate channels, because this was an official action that was taken by the Pima County Board of Supervisors. I think it deserves an official response on the part of the governor. So I will await that and to try to digest it. I'll tell you that we will continue to make the case that Pima County is ideally positioned to be able to take advantage of these additional 220,000 plus vaccinations, that we are ideally positioned, that we've created the infrastructure, that we have the personnel, that we have the facilities, that we have the capacity to quickly and efficiently deliver these vaccines. The only thing that we are lacking is the actual drug. And I hope that if this isn't the solution that the governor is offering to Pima County, that perhaps there is an alternate solution that he would offer to Pima County in terms of where we would get those additional doses.
And while, yes, I understand that, I know you don't know whether the governor has changed his mind or not, or that official answer, I completely understand. But the fact that it's gotten to this point, I mean, prior to this press conference, we understand that they had said no, and that was something that you guys, that the reason the board had to vote the way they did. So is it unfortunate for you to see that it took action from the board to try to get that federal assistance, and that there was that disagreement with the state on getting that help, that it had to get to this point?
It's always a challenge, right? And we will not always be perfectly aligned, and it is what it is. We don't get to make up. I certainly don't get to make up the reality that we're dealing with. Yes. Would I have liked a different outcome from the get-go? Yeah. By the way, it was ADHS that told us that FEMA wanted to talk to us about a possible pod, So when I first heard about it, I thought it must be supported by our friends at the state, if that's how the conversation's starting. So yeah, I would have wanted this to end up differently. Absolutely. Am I still hopeful? I am ever the optimist. I believe that this is in the best interest of the state, as it is in the best interest of Pima County, and I still hope that there is a way that we can get to yes. I think with that, I'm going to conclude. Right, Jason?
That's fine by me. Okay. I have no objections on my end.
So thank you, everyone, for being on today. We really sort of appreciate your interest, and we are thankful for your continued coverage, and we hope you are well. Thanks a lot, everyone. And I will have follow-up for those of you who I said that we would have follow-up for. Thank you so much.
Thank you.
Yes, if you would like a recording of today's session, please put your email in the chat, and we'll get that to you.